I'm Dr. Nichole Hardy-Swann. Welcome to the Swann's Nest podcast. I want to welcome Jennifer Price-Rossman, BCBA. I'm so excited to have Jen here today because we're going to talk about all things neurodiversity-affirming and assent-based practice, as well as opportunities to incorporate those activities and skills and ideas into internship and training fieldwork programs. So welcome, Jen.
Thank you.
Will you just tell everyone who you are and what you do?
Yeah, absolutely. So my name is Jen, and I am a board-certified behavior analyst with Swann Clinic. I am also the regional director for the Grand Valley, and I am the supervisor for everything fieldwork and mid-tier analysis.
Yay! Yeah. So you are that transition person from eager, wide-eyed student to competent practicing clinician.
Yes. That's
And
the goal.
you guide people through that process.
Yes. Yes.
Do you love that?
I do. It's my favorite.
Yeah. I know we've talked about it before, that just fuels you and you have so much passion for it.
I do.
How did you develop that passion for this process?
I have always loved teaching, and I've always loved teaching adults. Working with kids is great. They kind of have a more fluid mindset. Adults tend to get stuck in their ways. So when you can teach an adult new skills and kind of bring out that confidence, it's just, I don't know, it's super empowering, and I love that. And I'm very passionate about ABA as a practice. And so if there's other people that want to come nerd out with me, even better.
We do that a bit around here.
Yeah. Like every day.
Every day.
Every day.
But you also have experience as a teacher too.
Mm-hmm. Yes. So my master's degree is actually in special education, and I was a special educator for a number of years before I decided to make the transition to ABA. I worked with older students, and I was just trying to work through state standards. And I noticed that there was greater need. There was things that needed to be sort of skills that needed to be taught before that. And I knew that I could be learning more and doing more. So I really started heavily investing myself into the field of ABA and associating myself with other practitioners. And just, I kind of got this insight that like I could be doing more, I could be teaching more to those meaningful things that a lot of neurodivergent kids just need. So I decided to go get my postgraduate certification in ABA and obtain my fieldwork myself. And so, yeah, doing it all with 2 kids and working full time. It was a wild ride, but I love it.
Yeah, and then that's always, like, I was on internship, but yeah, fieldwork, practicums, internship, like, you know, it's all a balancing act.
Yes.
Yeah.
Yeah,
For
it
sure.
is. It is.
So how long have you been with Swann Clinic?
5 years. You're like, yeah, right. I know.
Oh my goodness. Can you believe
Since
it?
COVID.
Yeah. Yeah. I remember the first day you walked into the clinic.
Yeah.
Oh my goodness. I know that you've seen like a ton of growth within our organization and program. What are a few things that you've noticed about the growth and the changes in our program that you're the most proud of?
I think how we implement assent-based practice. That's huge for me.
And that's a buzzword. So remind
is.
everyone what assent-based practice is.
Yes, so assent is a buzzword. Assent is essentially an agreement to participate. So there's a couple of ways to understand it. It could just be giving consent if you're legally unable to do so. But for us, it is also just sort of like a nonverbal indicator that you are willing to participate. So body language, eye contact, engagement. We're looking at all of that to make sure that kids are actually enjoying the therapy that we're delivering, and that they actually want to be here and interacting with us.
Because kids who want to be here have better time, better outcomes.
Yes. And I remember when I was teaching, you know, their old adage, you don't have to like me, but you just have to learn from me. And I'm like, that is not how it works.
No.
You have to like me.
I think Jess said something like, I want to be a walking M&M for
Yes.
every child
Every
that walks
child,
through.
yes.
Yeah.
Yeah, same. Yeah.
And I love that. And I think like assent is so important because we work with kiddos from all different backgrounds with all different like neurodiverse profiles.
Yep.
And so especially like for kids who have like trauma histories and experiences, assent is so important.
It is huge. And my like research that I did postgraduate into aversive childhood experiences and trauma is what really fueled my passion for us implementing Assent-based practices, and not just saying that we do it, but actually having a way. How do we know if a kid is giving us assent? How do we know if they're withdrawing assent? And how do we measure that and actually put it into day-to-day practice instead of just, kind of bragging about it?
Yeah, for sure. And I can see that the practice is working because I hear our friends laughing and playing. So
Yes.
I'm like, yes,
They're having some fun.
They're having some fun.
Yeah.
They like being here. And I know a lot of parents are really concerned because when we start the process of onboarding our friends, our learners who are coming into our program, the concern is, as a parent, I have a child who is identified as having special needs or being neurodiverse, and that's a lot of trust to put into other people to say, here you go, take them for the day.
Yeah.
How do you see Assent playing into that building of trust within our program?
Well, one of the first things that we do with parents right from the get-go is we train them on what Assent is, and we train them on what we call our client input policy, which basically says every single kid has the right to participate meaningfully and give input on the way that they want their therapies to be delivered. Mm-hmm. And we do this every single day with every single learner, with every single program. And we really involve the parents in the creation and implementation of those programs as well. So parents are heavily involved. We like for our parents to know exactly what's going on with their kids every single day. Yeah. So they're very involved.
Yeah. And I think one of the concerns that they typically have too is my child being neurodiverse doesn't love change. Mm-hmm. This is going to be tough. How do you reassure them? And what do we do differently than other practices that ensures that our learners have a good transition?
Well, we have the parent here for basically the first 1 to 2 weeks, mm-hmm. for about 2 hours of every session. We're also pretty flexible. We also understand, I'm a mom, I have a 3-year-old that is typically developing, and she doesn't like when I leave her. You know what I mean? So we are flexible with that. We go with what each learner needs, and we adjust their schedule as they're ready. And we work with families and we work with parents. And I think too, just going back to the evidence, showing them the research, involving them in the creation of the original plan, mm-hmm. it lets them, I think that helps them to have that comfort. And also, the biggest thing is we don't even begin trying to do anything, classically therapeutic, working on certain skills until the kid's here and they want to be here. And what we find is after, the first couple of days, kids don't really want to leave.
Yeah. I've seen that too. Yeah. And as a psychologist, though, I know that the relationship between myself and my learner or the parents that I'm working with is the biggest catalyst for change and growth. Mm-hmm. And so even though you're not doing direct intervention, it's that pairing and rapport that you're building. That's intervention in and of itself.
Yes.
And building trust.
Yes. And what we know just from research into early childhood trauma is that just having one positive adult connection is the best intervention for lifelong outcomes. And so here we have a lot of adult positive connections, and we invite the family into that. And one of my favorite things is that, the families kind of naturally build their own community and their own sort of network of people that understand each other. Yeah. And what their dynamics are.
Totally.
Yeah.
I think one of the things that I'm most proud of with our program too, beyond implementing these Assent-based practices and neurodiversity-affirming practices, which goes back to our ethos of celebrating neurodiversity, yes. Is our accreditation as a BHCOE training site, practice clinical site, and telehealth site.
Yeah, we worked hard for that.
Yeah, we did.
Behavioral Health Center of Excellence. It was 2 years of hard work.
Woo.
Yeah.
And another 2 years of hard work. We've been credentialed since 2021. Mm-hmm. So it only took 1 year before we got our credentials.
Yeah. And then, but it's an ongoing process.
Yeah.
We're not done. We have to keep it up.
We have to keep it up, and we do that.
Yeah, we do that. But yeah, no, I love that. And I love the opportunity that we have to bring people that are students from across the country, mm-hmm. that are interested in our site, or just people that started off as RBTs that have seen the magic of what we do, that are now pursuing their graduate education with us. That's
or
so fun.
People who are looking to make career changes and change fields
yes.
you.
Yes.
And some of
There's a number of us that were former educators that are now they're moving into ABA.
Love it.
Yeah.
Now, being a BHCOE accredited site for clinical practice means that we are meeting certain standards for quality of care and outcomes. But what does it mean in terms of fieldwork and internship?
So what it means to me is that I try to make every fieldwork experience for every trainee individualized and intentional. So nothing is just because. It's not just come in here and do some programs and I'm going to sign off on your fieldwork. I align their experiences to their education. So I have access to their syllabi to make sure that the fieldwork that they're doing actually matches what they're doing in school. Because school, you get, the book smarts and, test ready. But that's just kind of the bare minimum. Those are the bare things that you need to pass the test. I want people that are, quality clinicians because we're here for the kids. You know what I mean?
Yeah.
So that's what I'm looking for, is somebody that can, walk through the doors and actually provide quality therapeutic services that kids want to participate in and that parents trust.
Yeah. No, I love that. And what do you think is, what do you think makes Swann Clinic? Because you had to go out and search for your own supervision.
Yeah.
And piecemeal it together.
Yes. I had some wonderful fieldwork experience, but I won't lie, I'm a little bit jealous because they just get to be here. They get to be working, going to school, and then getting that fieldwork experience, not just from me, but from other BCBAs in the company. And also they get to interact with multidisciplinary therapies, which is huge for me coming as a former special educator. Like, to me, I'm like, I don't know what it means to not work with speech and OT and psychology, that's huge for me. And they get that experience of what does it look like to collaborate with people that are practicing a little bit differently, but we all have the same vetted interest in this child and this family. So I think that's huge. And it teaches those soft skills that you may not learn in school. You might learn it on paper, but you can't really know how to do it until you practice.
Right. So speaking with someone who works in speech therapy, occupational therapy, physical therapy, psychology, you're getting experience on how to ask good questions, understand your own scope and the scope of others.
Yes.
And then enrich your understanding of how a learner needs to be supported from a very specific set of skills from multiple people.
Yes.
Yeah.
And I think it's just part of, we look at our kids as they're just little humans. You know what I mean? They're humans just like us. And, just for me, going to the dentist isn't going to take care of all of my needs. Just getting ABA is not going to take care of all of the child's needs. They need that full circle of care. And one of the things that I love about our fieldwork program is that you learn how to be part of that circle.
I think it's great. I love being able to consult our SLPs about how do we improve communication skills, and we're working on some of that, and then our RBTs also get to benefit from that, modeling and then that direct discussion with practitioners.
Yeah, and I think that it's great for RBTs as well. A number of them go into ABA, but a number of them go into OT and speech and other things just because of the ability to collaborate, like I said, with that team of professionals.
Yeah.
So,
and counseling. I have a few RBTs who have come through, and they do wonderful with parent training. Now, I think that brings up a good point. So if we have fieldwork students and trainees who are going through our program, what kind of activities and access to skills development and learning do they get at Swann Clinic that may be different from what you get in other places?
I think the biggest thing is that you're practicing it, 8 hours a day. I had some amazing fieldwork experiences, but not everything I was teaching, and a lot of the stuff that I was doing, I just couldn't really count. But everything that you're doing here is going to directly benefit what you'll be doing when you are a certified behavior analyst. And I give them exposure to everything from initial assessments to selecting and creating interventions to functional analyses, caregiver collaboration. We do, I work with them on how to support staff and teach staff. So I really try to make sure that if you're going to have to do this as a BCBA, you're going to have to do this as a trainee.
Mm-hmm. And onboarding?
And onboarding, we're in the process and one of the clinics now of onboarding. So
Yay!
It's going really well.
And writing treatment plans?
Yes.
Ooh.
Yeah. They're hefty, but they're
ITPs
fun.
and OTPs.
Yes. All the TPs.
What I'm hearing, though, from everything that you've said is that there's intentionality and structure to the experience, but so that it's less chaotic and more like taking advantage of the time before your credentials are issued, before it's you making that decision. And you have this like soft landing place, not just with like you, but with all of the BCBAs within our organization, and we bring in consultants from outside who give differing perspectives, and we can learn from them as well.
Yes, and that's huge. And I think too, you know, ABA is kind of an emerging field. There aren't a lot of BCBAs, and there's sort of this misunderstanding that just because you pass the test and you're a board-certified behavior analyst, that you're just ready to jump in and do everything.
I have a wonderful supervisor who told me, great, you passed your boards. Now you meet the bare minimum requirements to practice within your field.
Yes, that's kind of how I felt, you know, like I learned most of the stuff that I learned after I was credentialed. And so the fieldwork experience that I really hope that our trainees get is to feel like, okay, I've done this before. I know what this looks like.
Mm-hmm. Yeah.
And I've not done it just once or twice. Like I've done it independently multiple times.
Yes. Yes. I love that. And I think like you still have, I think we work through a couple of different things. Like we have our meetings and our groups and our individual supervision that we do. And as a supervisor myself, one of the things I talk about with emerging clinicians is, what is it? Imposter syndrome. Knowing your competence level and knowing when to ask for help.
Yep.
And then being very self-reflective on your process and growing your identity as a clinician.
Yes.
Yeah.
And I think that's huge. Imposter syndrome's real. We're all going to have it.
I still have it sometimes.
Yeah. And I think that big thing, like you said, identity is huge, because I think here, if clinicians are interested in, you know, what a lot of people are calling like the new ABA, where we are collaborative and we are celebrating the fact that people are neurodivergent. You know, a number of the clinicians here are neurodivergent. You know what I mean? And we are actually practicing Assent-Based care that can really shape your identity as a clinician and give you, you know, some legs to stand on to kind of grow into your own.
Yeah. And so not just practicing with neurodiverse kiddos, but adjusting our practice with our neurodiverse team too.
Yes.
Because we want to celebrate that. There's spaces for us everywhere.
Yes.
Yeah.
Absolutely.
I think it's so important that there is representation within the field, because I remember when I started out in grad school, I was working in the DSM-4 and DSM-4-TR. And at that time, you had to be non-speaking and 3 years old or under to get a diagnosis of autism.
Yeah, that's crazy.
Yeah.
I remember you telling me too, you know, with other neurodiversity such as ADHD, they wouldn't even consider, you know, autism and ADHD in girls until what, 2002? Yeah. So I think
that's when we started putting questionnaires in pediatric offices, was in 2002. So as a field, growing with our identification from the psych side, it's great to see that we've expanded our scope and understanding, and we're continuing to revise the way we operationally define what neurodiversity and autism looks like. But then as a field in ABA, and what I think Swann does so well and what you do so well, is that we are growing and going through an evolution of how we disseminate ABA. We're not one of these big box companies, these private equity owned companies. We're local, like these are our neighbors. And so we owe it to the families in our community to provide services where they know their kids are safe, their kids are being respected, boundaries are being built.
Yes.
And that we are teaching kids how to evaluate good boundaries, because autistic kids, neurodiverse kids, kids with special needs.
Yeah, they're more likely to be exploited.
Yes.
One of the first things that I teach all of my clients is how to effectively say no.
Oh, I love that. That was my first word.
Probably mine too.
But what does that mean to like effectively say no?
Well, first, I think it goes back to Assent-Based practices. It's being able to identify what is feeling good, what you actually want to participate in, what you don't really want to participate in, and then being able to either, like, stand your ground and say, like, I don't like this. Could you please repeat that? Could you please talk slower? No can encompass a lot of things. And it's really just that self-advocacy piece. It took me a long time to learn it,
Yeah, for sure.
And so I would love for all of my clients to be able to say, like, I didn't understand that, or this is not fun for me, or hey, it was my turn and I wasn't ready to share.
I love that. I love that. So even if they can't verbally speak that, being able to communicate that in some kind of way.
That's what we do, is we get to know our learners so well that we can identify those cues. Down to like, if they're looking away from you, they're not liking this. So you need to change what you're doing.
And what I just thought of something, and I know it's like sort of aligned with what we're talking about, but like when you are working with speech, like I know a lot of our friends and learners have AAC devices, and we work, again, multidisciplinarily. If you're running programming where you're trying to get like a specific response or help kids find their voice, can you talk to speech about those things and have them add icons or things like that?
Yeah.
Yeah, tell me more about that, like collaboration and crossover, especially for like interns and fieldwork students.
Oh, yeah.
Great.
There's very few things that I program or I have my fieldwork students program without collaborating with like speech and OT. I'm not a technical person, so if there's something with the AAC, I will go straight to my BFF Kelsey, who is our director of specialty therapies and a speech language pathologist,
as well as a former BCBA intern.
Yeah,
well, she's still getting her fieldwork hours too.
Yes, yeah. So she went through the training site a little bit with me.
What a like valuable asset to have, like an SLP, like emerging BCBA or someone who's been through the program.
She's a unicorn.
She is a unicorn.
But no, I collaborate with them a lot because they're going to bring knowledge that I don't have. So we have a number of kids that, have avoidant restrictive food intake. And I always say, ABA, we're the masters of motivation, but I am not going to try to touch swallowing or food texture with a 10-foot pole. That is not my scope. That's not my field. As far as sensory needs and sensory input, I am going straight to our OTs or our OTA. So I think that that's great that they have all of our staff have the opportunity to see that all of these fields have really, really unique strengths, and when working together,
best possible outcome.
Yeah, and so I'll even work with them sometimes too. If speech is working with a learner and they're trying to accomplish a goal, I'll say, like, this is what you need to do to motivate them. And then vice versa, I'm going to say, like, hey, I need to know your thoughts on how I should program this button here. So I work together a lot.
And do interns and fieldwork students get an opportunity to work that way with the other disciplines?
Yeah.
Sweet.
Yes, probably at this point, they have more direct contact than I do.
Yeah.
So they'll tell me things. They'll say, oh, speech said not to do this. And I'll be like, okay, thank you. Because they're doing it. They're there every single day.
Love that. Yeah. Love that. What are your thoughts about like our environment and how we work together as a group, and like communication and respect amongst our team?
I love that. I mean, that's one of the things that we vet very early on. I am a pretty no-nonsense person, and I like open and clear communication. And especially, I mean, if you're going to be working with neurodivergent kids, you can't really beat around the bush. You just have to say what you mean and mean what you say. And I think that with our team, we're really good about that. And we're really good about just being like clear and objective, and we have policies in place if things get cloudy and murky, that, keep things sort of cut and dry. And I appreciate that. And so far, everybody in the team, whether it's ABA or specialty therapies or on the psych side, I feel like we kind of all have that same understanding of just, we don't really we're respectful, but we are open in how we communicate.
Yes, absolutely. And I think one of the things that, as a supervisor for me, I'm also always kind of giving a lot of space to make mistakes.
Yes.
Especially like when I choose someone who can work under my license or practice.
Yes.
I'm very careful with that. I really appreciate when individuals understand what a big like privilege that is
Yes.
based on the amount of time I went to school and how much student loan debt I
Yeah,
have.
same.
But also for like what my continuing career goals are for our community. And so, but I also think that like part of the process is making mistakes and having a soft place to land. So while we do maintain that respect, talk to me about your supervision style as it relates to like processing things that we can be doing better, or when we make a mistake and like what that looks like, because they're inevitable.
Yeah.
Even though we try not to do them, but
yeah. I always say clarity is kindness.
Yeah.
And one of the things that I tell not just the trainees, but all of my staff is like, if I have a concern, you're going to know about it.
Yeah.
Right away. I'm not going to hold back. I'll be respectful. And that's what I would hope for me. You know, I get that, you know, we all get that imposter syndrome. We're sort of like, are you mad at me? And I'm like, you will always know exactly where you stand. And I will just always be very objective and say this, you know, even for little things, like, I want you to change the way that you're doing this error correction and add this. Cool. Go try it and see how it works.
See how it works.
Yep.
Love that. I think it's so important. Like this is like going through the field and learning how to be a clinician. There's obviously like so much growth you do, not only externally and then like academically, but internally, because you are a tool of your practice. Like you are the instrument that is used in order to make this beautiful music. And so you have to be aware of like who you are and what's going on internally and just check in with that.
Yes.
So I tend to do a lot of that with, you know, myself and working with my interns and practicing.
Same. And I try to model that as well.
Yes.
I try to model like, I'm going to step outside and get fresh air because my brain needs a transition from a meeting to an assessment. And just giving them that space and just saying like, hey, if you need to go take a break, you go take a break, you know.
Or I'm fallible. That parent training didn't go exactly as the way I wanted it to. How can I improve the way that I'm disseminating this information?
Yes. And we do a lot of, you know, just debriefing. You know, we had an assessment where it's like, this is what we could do next time with this assessment, but what did we still learn?
Yep. I love that. What do you think makes Swann Clinic stand out to you as a prospective student? And then also, well, I'll start there.
Okay. I do think just the fact that we are multidisciplinary, a lot of practices are open and willing to invite other providers in, but we have providers here. They're in-house. We
know them.
Yes, we know them. We're friends with them. You know what I mean? I think that's huge. I also just think the fact that, sorry, it's hard to like put all of it into words.
Sure.
I think the biggest thing for me, like I said, is that with Assent and with neurodiversity-affirming practices, it isn't just sort of like a moniker or a nice thing to say. It is something that we actually conceptualize and practice, and we graph it, we program for it. You know what I mean? Like the proof is in the pudding, so to speak.
And Assent-Based care with early intervention, that is not easy.
No, but it's fun.
Yeah, it is. I know. I got to play kitties the other day, and I was like,
I was playing hide and seek just before we started talking. I went under a kiddie pool.
I love that. I always walk in and just like, it's like the thing that just gives me air and life. I love it. Well, Jen, we're going to wrap up, but I think like the thing that I really just want to like make sure that we've addressed here today is that like our practice is one that I personally feel like I want to disseminate this better way of practicing ABA, of reconceptualizing and reworking the field and what has been done in the past, and help it evolve to match what we are seeing in our society, and respecting that our tiny humans are humans with needs for safety and needs for someone to hear them and to listen to them and have a right to a voice, and that we are helping train practitioners and future clinicians to have that same thought process and really push that out into the world, whether they stay with us long term or they go disseminate it somewhere else. When you have the name Swann on your resume, that means something.
Yes, absolutely. I completely agree. And I think, you know, one thing that I tell all of my staff, but particularly my trainees, is that our clients have the right to be neurodivergent.
They do.
They do. And they're our boss.
Yes. Yes.
They are. They're, you know, they're tiny humans with full human dignity, and we're just here to support them and help them learn in the way that they can learn the best. And if there are people out there that believe that everybody has the right to be neurodivergent and not completely fit into a mold, but they still deserve all the tools to navigate life, and you believe that therapy should be led by the kid, not by the grown-up, really, while still teaching those essential skills, then I think that's one of the things that stands out. And anybody that's passionate about that and wants to, you know, stand on soapboxes every day, you can come. I have space on the soapbox.
Please, we'll make space.
We have space on the soapbox.
Space, we'll make more space. We have this like section of our podcast where we talk about myths and we attempt to debunk them.
Okay.
And one of the myths that's out there is that assent means kids just get to do whatever they want. There are no rules or boundaries. They just get free reign.
No, I love that you asked that. That is not what assent means.
Okay, good.
Yeah, no. There's some fun out there.
There is some fun.
Assent means that you are arranging the environment and the activity and the therapy in a way that is going to be enjoyable and meaningful, right? We all have things that are kind of optional in life. We have things that aren't optional in life. Either we want to do them or not. But what can we do to make this more comfortable? Also, anybody that's in ABA, or I would even say pediatric therapies in general, we're probably naturally very curious. So this is our opportunity. Like if a kid's not wanting to engage, why? Let's get curious. How can we motivate them? How can we make this meaningful? How can we teach them that this is an important thing to do or an important skill to have? And it's not easy. It's not easy, but it's doable.
It's doable.
Yep.
So another myth that I often hear is that when our learners are in clinic or when learners engage in play-based therapies that they're just playing all day. They're not really learning anything.
Well, I would say, how do you think that kids learn? They learn through play. That is the greatest way that they learn. I mean, it's really built into them and who they are. We rely heavily on what we call natural environment teaching. So you can absolutely 100% use play to teach and learn skills. And as a matter of fact, that ties right into Assent-Based teaching, because if you're having fun and you're learning, that's a win-win.
That's how you're going to grow.
So we play a lot, but
play a lot.
We learn a lot too.
There's purpose in the
Yes,
play.
there's purpose in the play. And I would say there's no such thing as purposeless play. That's how kids learn.
Yes. Yes. Oh my goodness, I'm going to steal that. There's no such thing as purposeless play. Another myth that I hear is that, kids should be in school. Like they should immediately go to school. That, full day clinical practice, full day clinic, is just not the right space for them, and that kids are better served going straight to school.
Some. My kids went straight to school.
My kids went straight to school.
I'm a believer in free appropriate public education. My husband's a public educator, but not all kids are ready for that. Like I said, we have to break down what skills do they need in order to sit and meaningfully take in the information that the teacher is going to be giving? Are they able to sit and pay attention? Are they able to imitate? That's a huge thing. We'll teach imitation, and I'll explain to parents we're teaching this because what they're going to learn in school is how to imitate what the teacher is doing. And if they are,
and their peers,
and if they aren't able to really sit and imitate, then the school day might not be meaningful for them yet.
Maybe they'll build that skill,
but they need to have the skills to make that meaningful. And so sometimes that means that kids need to take a little bit longer in clinic to build those skills, because when we send kids to school, we want to send them completely ready and completely ready to learn. I have so much respect for teachers as a previous educator. They have things that they are supposed to be teaching, and I want to make sure that our kids are ready to learn all of that.
And we've had such success with transitioning our learners into kindergarten and getting established as best we can with, with what the goals for the family established and what we establish are. we've had a lot of success
Yes.
of getting our learners into school, ready for school with some of those foundational skills that are going to be really helpful and meaningful to them.
Yes.
And where they're safe in those environments.
Yes. Where they're ready to make friends. They know that teachers are trusted adults. They can trust in what they are being told to do. Even little things. They know how to navigate a playground.
And how to advocate when things don't go
Exactly.
in a way that they
How to
feel safe and
negotiate with
comfortable with.
peers.
Yeah. So, and I think that there's just a ton of research too about early intervention being between 20 and 40 hours a week, which is what we offer and provide. And usually on the 40-hour side, I often tell parents this is like therapeutic learning. Like it's not, we're not a preschool, we're not a daycare. This is a learning environment to build foundational skills. And that way we can be successful in our transition to kindergarten.
Yes. And what we know is kids in general need many repetitions of practicing something correctly before they've got a skill.
Well, isn't it like neurotypical kids maybe need hundreds of exposures, whereas neurodiverse kids need thousands for learning?
Yes. And so one of the reasons that we offer the intensive level of comprehensive care is so that they get those repetitions over and over and over and over and over and over and over in a way that's fun. And then, we teach parents how to do that too, so that they're getting it at home as well.
Love that. Yeah. Love it. So one myth that I do hear and that people kind of comment on is that early intervention is easy. Did we say that already? Did we talk about that?
No.
Oh my goodness.
No.
Have I told you that?
No. People think early intervention's easy.
Yeah.
Oh. I worked with all ages, to be fair. I worked with like not even 2 to 18.
Yeah.
So, it's not easy.
It's not easy.
It's really fun. There's different fun things about every age group. There's different challenging things about every age group. One thing anybody that's worked with kids or has had kids knows, young kids need a lot of attention, and you need to be on all the time and ready to play all the time.
All the time. Yeah. But with younger kids, what we have is just like such an opportunity to really watch, observe, and hear, not just through emerging language, but through their behaviors and their personalities. So we're less reliant on speech, which is great because most of our communication is not verbal.
No.
It's
It's not. And that's kind of where it goes back into Assent, is like just simply being able to say no, thank you is not enough to indicate if somebody is enjoying a conversation. As adults, we use so much paralanguage. Like when I will talk to some of my staff and I am telling them a story, everybody might be like, Nichole, that might say, I have something fun to tell you. If I come up and I'm like, Nichole, that might be, I have a favor to ask you. So much of our communication is nonverbal.
Yes, exactly. So I think it's just such an opportunity to like really kind of take verbal communication off the table and really get to know a friend, know a learner, and really kind of help them grow and evolve beyond just what is said while helping them explore what their voice is.
Yes.
Yeah. And I think it's important to note too that we do no kind of physical management.
No.
We never put our hands on kids.
Not unless to play or to jump or if they ask for a high five. But no, we don't physically manage.
And we kind of work very specifically on good boundaries with that because sometimes our friends do want hugs and it's not appropriate. So we're really building the skills.
We'll teach, different skills of like, how do you approach somebody that's an acquaintance? How do you approach somebody that's a, community helper? How do you approach somebody that's a friend? So we'll work a lot on that as well.
Last myth that I was thinking about too is that ABA is dangerous or that it's harmful to kids. And I think that's a barrier, especially for our parents who were previously maybe exposed to this or have listened to the community and to voices of real and actual like individuals who've been through ABA before who did not have great experiences.
I think done poorly, absolutely.
Yeah.
I think no ABA is better than bad ABA.
I agree with that. Oh, wow. Yeah.
I think good ABA is absolutely magical and life-changing. But I think that can be true for anything. We've all had a coach that went a little too hard on us and burned us out on our favorite sport. We've had teachers that have empowered and inspired us. And when we've had teachers that have made us feel shamed and punished, I mean, it can be true for anything, and definitely ABA, and definitely, back before we started really exploring the realities and the integrity of being neurodivergent, a lot of ABA, and not just ABA, but any therapy, was really about making people look neurotypical.
Yeah.
And that is harmful. That's asking you to deny your identity and fit into a mold. And that is harmful.
Being conformist.
Yes. And so we don't do that at all. And if that was the only way the ABA looked, I wouldn't be a BCBA.
No. I think one of the things we talk about in psych and in our reports is that, in generalized pervasive masking causes more distress and builds anxiety. And that's where we see decompensation and, impact on mental health. And so I don't want kids to be anyone other than who they are. I just want them to have the skills that they need to achieve their goals.
Exactly.
And be safe.
They're tools.
Yes.
They're tools to be accessed, not molds to fit into.
Absolutely. Yes, absolutely. And secondly, just kind of piggybacking off of that, what I think is so important is that because of the way the field is, you could get into a program where you think it's one thing.
And it's not.
And it's not. And we've had so many people who have come to us who have said, this is what I was taught. And we were like,
you're going to have to unlearn that quick.
fast. And I'd rather, as a fieldwork student or an intern, I'd rather learn it the correct way first and the best practice way, as opposed to having to correct that.
Absolutely.
As an established practice.
Yes. And unfortunately, I do think that there are some organizations and some practitioners that implement ABA in a way that I disagree with.
Yeah.
But that's why I'm here.
Yeah.
And not somewhere else. And that's what I teach our fieldwork students. I mean, we don't do any kind of punishment, any kind of coercion, no physical restraints. And I mean, it works. We don't have to.
Because the more kids have exposure to punishment or physical management, the more they rely on those
they become
things.
Conditioned.
Yeah. And so it increases the likelihood. So by not training our team to even do that in the first place, we've taken that off of the... Because most people, if they're trained in physical management...
You go to it.
You go to it.
Yeah. And I was formerly trained in physical management. And I don't like it.
I don't like it. No. And I don't think parents would really like it either.
No.
When I was thinking about the kind of practice that we would build, not only am I so incredibly proud of the integrity that you and our team have brought that has made this practice so special and unique, but we really pioneered this Assent-Based practice in this valley, in this area. And it's a place where, if this were my child, I would happily send them here.
Yes.
Happily.
Yeah.
Because I know that my kid's going to be safe and no one's going to do anything that violates their rights and kind of puts them in harm's way.
Yeah. Or accidentally teaches them to expect something that they shouldn't expect. And, I kind of just think of it as as an adult, we don't use, we don't ignore kids if they're misbehaving. You know what I mean? If somebody doesn't,
that happens,
it does happen. Yeah. If
wait them out.
Yeah. If I'm saying something that somebody else doesn't like, that's not normal. If we're having this conversation and you suddenly say something I disagree with, I'm not just going to be, that's not life. That's not normal. You know what I mean? And so I want to make sure that every experience that they have is going to mirror what to expect as an adult who's a respectable and, contributing piece of society, because that's ultimately, like I said, they're tiny humans. They're treating them like tiny humans, and it's not normal to just ignore somebody, and it's not normal to just, pick somebody up and move them when you don't like what they're doing. That's not normal. That's not, how we'd be treated. And if we were, there'd probably be a lawsuit or something.
Yeah.
You know what I mean? That's just not
true.
how life.
It's just not practical once they grow into 80 pounds either.
No.
So I love that. Thanks, Jen, so much for talking to us today about what your experience is like and what your role within our organization is and where your passions lie. I love that you're wanting to create like-minded clinicians who have maybe not think just like you, but have access to the same kind of curriculum and experiences and worldview that is Assent-Based practices, and doing that in a meaningful way that really values and cherishes the voices of our friends and learners and our parents and makes them a collaborative part of our process, because I think it takes one spark to start a fire, and we need to reform this field and make sure that the standards are raised so that everyone gets access to this kind of care. Jen, thank you so much for being here today. I appreciate it. We're taking time away from everything to talk to us. I love your perspective. I'm excited about your program, your internship and fieldwork program, and I just cherish you as a mentor to our team and a safe place for our learners and our clinicians to kind of land in this field that can feel kind of overwhelming and chaotic sometimes. So I really appreciate that. If you are interested in being mentored by Jen or want to learn more about our programs at Swann Clinic, please go to our website at swannclinic.com, www.swannclinic.com, and check out more information about what we have to offer. Thanks, Jen.
Yeah.
Yay.